Hi guys, welcome back. So today I want to do another Nclex video, this time talking a little bit more specifically about what's on the exam. Okay, so the first thing that you should prepare for are a lot of select all that apply questions. My exam was so many select all that apply questions. It started out with a couple multiple choice, and by the end I felt like I was doing all select all that apply. Obviously there were some multiple choice here and there, but it was mainly select all that apply. You want to practice answering these questions, you want to treat them as true, false, and you want to be decent at answering them. You're not going to get everyone right all the time. They're really hard level questions, but you want to know how to approach them. The next thing is a lot of infection questions, like if this person has an infection, what room can they go in with another patient? If this person is on contact precautions, what should the nurse do? Those kinds of things. A lot of questions focus around like leadership, like priority, delegation, float. So if you have a float nurse from, let's just say labor and delivery or peds or something specific like that, and they're coming down to med-surg, what patient can they take? Well, you need to think about what's their normal assignment and then pick what's closest to their normal assignment. Don't have them do things that they've never done before. That's not really safe. Other questions are exhibit type questions. So these will have you look at trending lab values or just regular lab values by analyzing the data. It's not just going to say what's a normal calcium level. It's going to say, like, it's going to make you analyze it by clicking on a thing, looking at an exhibit. You can also have hotspots to click on, so make sure you know like a couple anatomical locations, specifically with the heart, or maybe like injection sites for vaccines, that kind of thing. PHARM questions, and these questions will focus more on patient teaching, patient safety, when should they take the medicine, and what should you teach them. It's not really going to be like, what is the mechanism of action, what drugs can't be taken together, that kind of thing. Delegation, what can your LPN, what can your tech do? So delegation questions are huge, and they will be select all that apply in there. And there will be a lot of questions about priority. Who do you see first? Who is the most severe? Those kinds of questions. And you're going to be able to easily eliminate 2 out of 4 on most questions that are multiple choice on the Nclex. But you're going to need to decide between those 2 patients that are both critical, who do you see first? So those kinds of questions are all throughout UWorld. I highly recommend using UWorld. And the other type of question you can get on Nclex, which I heard isn't happening right now because of the pandemic, are math questions, but it's just normally basic math, know your burn calculations, but besides that. So those are the kinds of questions that you should expect on the Nclex.